Hello and welcome to the GeneDx podcast. I'm your host, Patrick Short. My background is in population genomics and studying the genetic causes of rare disease. I did my PhD at the Sanger Institute in the University of Cambridge and have been in biotech since 2018 when I started Sonogenetics. Sonogenetics helps academic and industry researchers to run large-scale genetic testing programs that speed up their clinical trials, generate data sets for the next big breakthrough, and give participants the best possible experience taking part in research. Each episode of the GeneDx podcast, we bring you insights from the leading minds in genetics and precision medicine, including household names and Nobel Prize winners, as well as early career scientists and biotechs working on the next big breakthrough. Whether you are a scientist, entrepreneur, executive, patient advocate, or simply someone curious about how genetics shapes our world, you're in the right place. Thank you for listening, and let's get started. Welcome to the GeneDx podcast, everyone. I'm really excited to be here with today's guest, Lisa Gurry, who's the Chief Business Officer at GeneDx. They have been an amazing success story in precision medicine. They have, I first heard about them, I want to say it was 7 or 8 years ago when the academic group that I was working on in neurodevelopmental disorders did an academic collaboration with GeneDx. And in the time since then, the scale of diagnostics they've been offering to patients with rare diseases, the public profile of the company has just gone up and up and up, and the quality of people there is amazing. Lisa obviously is no exception. I think you've joined relatively recently, and I would love to just start with your story of why you decided to join GeneDx and what motivates you, and then we'll get into a little bit more detail about the company.
Sure. Thanks, Patrick. It's exciting to be here today and get to talk with your listeners. You know, my journey to GeneDx has been unexpected and also amazing. I have had a background in technology and healthcare for the last 30 years, with the majority of that actually in technology at Microsoft. Then I co-founded a health data company called Truveta about 5 years ago, and really dove deeply into health data and the potential of health data to transform healthcare and to save lives. This summer, I had the opportunity to get connected with Catherine Stuhlin, the CEO of GeneDx, and was just absolutely blown away by her authentic mission for helping families around the world receive the fastest diagnosis possible for rare diseases. And the focus, I thought, was super important for the world at large. Oftentimes, rare diseases can be overlooked. Children are, I think, our most important audience to serve. And the lessons and opportunities to transform healthcare can really expand exponentially, from that work. And so that authentic passion that Catherine shares, the tremendous transformation she has led for the business itself, really creates opportunity for us to do so much more for the world. And so it was really just this kind of perfect combination of a mission that I feel incredibly aligned with, an incredible leadership team, great business potential, and transformative technology all coming together.
So Lisa, when people who know about GeneDx, probably the first thing they think about is clinical genetic testing lab and diagnostics, but the company is way more than that. You've got a lot of different pieces that ultimately do line up to this theme of early diagnosis and genetic testing, but maybe you could just help people understand what are the key parts of the business and how does it all fit together?
Sure. GeneDx has actually been around for about 25 years. It started as a research project within the NIH in the United States, and it's gone through several iterations. And really under Catherine's stewardship in the last 3 years, it's created this kind of clarion call of focus on helping children and their families get the fastest diagnosis possible for rare diseases. And so that's done through genetic testing. We offer exome and genome testing, as well as a range of other tests as well. But we're particularly passionate about the exome and genome testing that we provide. Over the duration of GeneDx's life, we've tested over 2.5 million people. We've sequenced over 1 million exome and genomes, and that has really been, I would say, the core of our work, the core of our passion is delivering those answers to families as fast as possible, because we believe in the transformative power of that knowledge and the clarity it brings. At the same time, GeneDx is also very much, pioneered its role within healthcare, and they've contributed, a number of gene disease contributions to society. They've published over 1,000 publications. They're deeply invested in the healthcare ecosystem and advancing research driven by genomic medicine. And that's something we're really excited to do much more of in the future through collaborations, both in healthcare and beyond, across advocacy groups, biopharma, policymakers. That ecosystem is something that we're very excited about continuing to play a major role in. And then finally, that same data that I mentioned that we receive through the genetic testing that we provide gives us an opportunity to create an incredible data engine called GeneDx Infinity, which is our ever-growing asset of genomic data married with 7 million phenotypic data points that can serve as a source of discovery and research analysis capabilities for researchers of all kinds. But we believe it can really be transformational in helping drive drug discovery, clinical trial efficiencies, and also fuel research of all kinds. And so, we're very excited about each of those kind of three components, but all, starting with genetic testing at our core, helping, create a network impact, if you will, within healthcare, and then fueling discovery with GeneDx Infinity.
Can you talk a little bit about newborn screening? Because this is one of the things right now that when I see announcements, half the time or maybe more, it's GeneDx that's providing the core infrastructure to do. And I'm talking about healthy newborn screening, some of the very high profile programs. It's of huge interest to me because I think it is in some ways the pinnacle of early diagnosis and detection. If we can find a model that allows us to do healthy newborn screening in a way that the health economics makes sense, then it has potential to completely transform healthcare because of the fact that our genetics don't change, right? And we can reanalyze over time. I'd love if you could just talk about what you envision there, and how you all think about the opportunity for newborn screening.
I think that that opportunity with newborn screening is something we're particularly passionate about, because the fastest way to diagnosis is, when a baby is first born. And, there's so much power that comes with that knowledge. And so we're really committed to doing everything we can to prove the importance of that, to prove the value of that. And, that comes, largely through embracing technology and also through great collaboration, across healthcare. So, a few examples of collaborations that we have underway. One is with a program called the Guardian research project that we did that really laid the foundation of clinical evidence. And so essentially what that program did, it screened 20,000 healthy infants with the goal of getting to 100,000. And what we found already with the 20,000 is that 3.2% of them had a positive rate for a diagnosis of some sort. Oh. And what is even more interesting about that diagnosis rate is that 92% of those true positives would not have been found otherwise. And so these are children that probably would have seen developmental delays. They would have, they would have been diagnosed over time. But what we want to do is decrease that diagnostic journey. And so those children are getting the best care possible as quickly as possible. It can be truly life-saving in the case of certain genetic conditions. And in the case of most of them, early intervention therapies are also incredibly valuable and are most valuable the earlier you start. A couple of other examples. One would be a Beacons program, and this is a program that we just announced in conjunction with a number of different states in the United States. So 10 states funded with over $14 million from the NIH. And the goal is to essentially, across those states, embrace genetic testing in 30,000 newborns, with the goal of, again, learning from the power of that newborn screening, being able to help articulate both the impact to the health of those children and the value back to the health system, because so much of this, of course, is a cost consideration. Unfortunately, at the end of the day, you have to justify the cost of the test. We're finding in so many examples, though, that the value of that test is far greater and far more efficient than years and years and years of diagnostic uncertainty. The average diagnostic journey, for a family on this path is usually 5 years, with up to 16 tests, up to 3 misdiagnoses. And so what we want to do is really shorten that journey. So it's not that, not only is that incredibly hard on a family, and the child typically suffers quite a bit along the way. It's also incredibly expensive and burdensome on the healthcare system. And so those are just a few examples of some of the programs that we have underway to prove the value of shortening that diagnostic journey. I guess the third one I would highlight is Sunshine Genetics is a program that the state of Florida is pioneering, where it's essentially the first state-backed newborn screening program where every child in the state will have the opportunity for newborn screening. And we really hope that that will be a pioneer for other states to follow. Certainly, with the opportunity for all of those families, to get the best knowledge possible. One of the things that has kind of blown my mind as I've dove into this space is that I've had 3 babies myself. They're older now, so they're 23, 21, and 18. But when you have a baby, that baby's health still is essentially assessed to be an APGAR test, which was essentially came to fruition in 1954. And so you think about what other part of medicine for your routine screening, it's still from
maybe the stethoscope. Yeah.
Yeah. It's like what other part of medicine, is still embracing 1954 as a standard of care. Right. And so we're so overdue and, a better standard of care for these babies, for their families. And it's something that I'm personally passionate about. And so I love these programs because I think that they will help us illustrate how valuable this can be for those newborns.
When you talk to these programs, and we don't have to go into any specifics because I'm sure it's relatively confidential, but in general, how are they looking at these programs where they may be committing to tests 30,000 or 100,000 or 10,000? Do they have really clear criteria of if we see X, then we'll roll this out across the state, or is it pretty exploratory at this stage where they're saying we know we're going to see some things, but we think we should do it, but we have to figure out, okay, how do we even measure the value of this long term? I'm curious to just get your insights on that, because we really need the health economic case to get this to scale eventually.
Yeah, I think that, the thing I love is that there's a real shared passion and a real shared urgency and belief that this will save lives. This will help improve the lives of these babies. And so, some of the programs have very specific goals. They typically have a goal of number of children that they want to sequence, to help have enough representative scale, to learn from. And then the science, is proving out that, rare diseases aren't that rare, actually. It's 1 in 10, people in the United States today. As more and more of those diseases get identified, as more of those variants kind of roll into our genetic testing, today we look at 20,000 genes. That will continue to grow as more and more people are tested, which helps then the answers get more and more precise. So the opportunity to learn is significant. Another good example is Seattle Children's Hospital did a research project called Seek First, where they looked at in the NICU, the impact of genetic testing in the NICU. And they found that 60% of infants in the NICU should receive a rapid genomic test. So you think about those babies, they're born, they've got health challenges, they're starting off at a tough spot in life. And so that I thought was an incredibly interesting example of how valuable that rapid genome test could be in the NICU to help them with precision, identify, okay, what additional tests should we be doing? Should we be looking at a heart? Should we be looking at a digestive system? How can we, get the fastest path to more clarity for these families? And, that's another, kind of good example of then they were able to also illustrate that, of those babies that receive genetic testing, a genetic diagnosis in the NICU could save a health system cost savings of $150,000 per patient per year. Wow. And so that's, I think, a really good example of a tangible finding that was done in a peer-reviewed representative study that hopefully will be really instructive for other health systems across the country.
Yeah, I love that. If we zoom out more broadly from newborn screening, as you mentioned, you all do a lot of whole genomes, you do a lot of exomes. What everybody will tell you is these days, sequencing the sample is not the hard part. It's really interpretation and making sense of the vast array of possibilities and correlating that with what you know or don't know about the patient's phenotype, resolving variants of unknown significance. Would love if you could talk about what you all have learned about that from sequencing millions of genomes, and how we can scale that better going forward, but also give people the best possible outcome in terms of accuracy and thoroughness of their results.
Yeah, that's super, super important. I speak from personal experience. My third child has multiple rare diseases, and she didn't receive her chromosomal syndrome diagnosis until she was 13 after her third round of genetic testing.
Oh my gosh.
So she's 18 now. So this was, earlier days of science. But I have a lot of empathy, for families and the importance of early diagnosis, as well as the importance of an accurate diagnosis, because I know what it's like when you're not getting the diagnosis, or the answer is the variant of unknown significance. It's a little bit of a helpless place. And so one of the things I love about GeneDx is that with that 25 years of experience, with that rapidly growing Infinity database, it really gives us the largest set of data possible to be able to assess and have the strongest interpretation platform possible. And so the data is important. The technology is important, because with AI, we can scale and learn so much faster than ever before. And then the third piece that's incredibly important, that I love that GeneDx is invested in, that many have not, is the clinical expertise that helps ensure that the combination of the data and the technology is super powerful and as accurate as possible. And so, we employ over 100 MDs, PhDs, over 150 genetic counselors, and all of those folks are deeply involved in the diagnosis and the articulation of the test results back to the family. And that's something that I think is super important, is this combination of the data, the technology, and the clinical expertise, and the magic of that is really, I think, what families can take comfort in and trust in, that they're getting the best answer possible. And as I mentioned, those answers are only going to continue to get more robust over time as more people get tested. I think that's an important message for families that are considering genetic testing, is not only is it super powerful for helping you understand the health of your child, it also creates kind of a genetic blueprint of health for the rest of their life that you can keep coming back to. And as science continues to improve, you can continue to get more information relative to the best path to health for that child. And that's something that I think is really important for families to understand, that's under communicated today, I think.
I had you reminded me of a really interesting conversation I had with Robert Green on our podcast a long time ago. I'll dig up the episode number in the background, but he made the point that one of the things that's really challenging about this sequence once and then interpret over and over model is the way our healthcare system is structured. You have cardiology, you have neurology, you have pediatrics, and genetics obviously cuts across everything. And I'd love to just have your perspective on how you think about, we have probably the technology, but how do we think about the business model or the way of interfacing with the healthcare system, where we could in the future move closer to, hey, you've been whole genome sequenced once, and maybe it's through a newborn screening program, but we're not going to return a cardiomyopathy risk factor or an ApoE4 risk factor or something like that in a newborns program. But you may want to revisit that at a later stage when the time is right. But how do you pay for that reanalysis? How do you even get that done? I'd love to get your thoughts on that.
It's a great question. I think that there's so much potential for that genome to help guide precision medicine for the rest of your life. Once you have that understanding, I would love to see us create a world where you essentially have a genomic passport that is yours. And so as you move around the country, as you move around the world, you carry that genomic passport with you. That can be, if you think about, when we go to the doctor today, right, it's kind of the standard, how much exercise do you do? Do you smoke? How many drinks a week do you have? And how much better would it be if you could bring your genomic passport along with you and have that to help guide care, in addition to all of the other important factors, certainly. But as another really important input to care that's provided to you at each stage of your life. And, certainly, the science that we have today won't be the same 5, 10, 20 years from now. And so, what might that what might that science 20 years from now tell us about the genome that we were born with, and how can we use that not to guide our treatment once something's diagnosed, but ideally to prevent and cure diseases before they even happen, or to delay their onset. I think this era of personalized medicine that is predictive, that's curative, is upon us. And ideally, we can build the systems that both encourage and enable the health systems to take advantage of the data and the technology available to them. And then also for the patient, to have that opportunity to have a bit more control over their own health, and have that accessible at scale is really, I think, the trick that this current new generation entering the world absolutely should have that opportunity.
Yeah, I want to talk a little bit about the data platform that you mentioned, GeneDx Infinity. It's got, I think you mentioned, million plus genomes, 7 million plus clinical data points. What have you found is the most interesting thing that it's being used for? Because I can imagine you've got basic research, you have feasibility for trials, you have all sorts of really interesting things when you have data at that scale. What to you are the one or two most interesting things that you've seen your customers or internal teams doing?
Good question. I think, one of the things that I'm excited about is a recent partnership that we announced with Jaguar Gene Therapy, where with them, we're working on an autism partnership program that I hope will unveil all kinds of interesting insights. Autism certainly is one of the more common rare diseases, if you will, affecting so many people and so many people at different severity. And so their focus is really looking at how to learn more about patients with SHANK3 related autism spectrum disorder and the Phelan-McDermid syndrome that impacts them. So it's a specific form of autism. But essentially, what they have chosen to do is sponsor genetic testing for patients that have this condition, with the goal of being able to collect as much data as possible, and certainly, the genome of those patients, to help certainly learn today, but also to guide future treatments. And so those programs I'm incredibly excited about, because I do think that once you have a diagnosis, once a family has a diagnosis, you're very incented to want to do anything you can to find a path to better treatment, to find a path to a healthier life. And helping connect the dots, between advocacy groups, patients, biopharma that is, has a like mission, is something that I think is super exciting. And really, data is at the core of all of that, because data is what's going to empower that discovery.
When you're designing those kinds of programs, is it it strikes me as one of the hardest things must be to actually identify the right patients who are candidates for a program like that, right? Because you've got to strike a balance between the company paying for it can't necessarily test everyone, but also you need to test enough people to make sure that you're getting enough to meet the goals of the research program or the clinical trial, but whatever it is. What have you learned about how you strike that balance between going for incredibly broad testing programs versus something that's a little more focused?
It's a great question. I think that's where individual advocacy groups can be incredibly valuable. So a lot of advancements in medicine have been driven from these patient organizations themselves. They're committed, they're passionate, there's a sense of urgency because they're trying to help someone they love. And so I think, the ability for us to have deep connections within these different advocacy communities, of which there are many, certainly at the umbrella level, but then also at the very specific condition level. And that really creates an opportunity to connect with different biopharma partners that have a very specific focus in mind. And so, one of the pieces of advice I give to families in this situation is to get involved in the advocacy group for the cause that you care about,
Right.
Or the cause that's impacting your family member, because not only is there great knowledge and a source of community today, it could also really help get you connected to clinical trials that can improve care, for your child, and or enable your child to contribute in a way that helps not just them, but also future generations that, may have the same condition. my daughter goes to a music class with other children that have special needs, and one of her classmates actually has Angelman syndrome, and she's 21. But she just actually did another round of genetic testing just so she could be ensure that she was in the loop, if you will, on the latest thinking on clinical trials and the opportunities for kind of new medicines to inform care. And that's something that I hear a lot about in the community. Certainly the importance of testing the newborn, certainly the importance of helping get that diagnosis as fast as possible. But then there's also generations of older children. So my daughter Taylor, who's 18, her classmate who's 21, who the science just wasn't as good, when they were going through their own diagnostic journey. And now there's an opportunity to help connect them back to ongoing developments. And so I really encourage any family that's on this path, or clinicians supporting families on this path, to get connected to these advocacy groups. They do heroic work, and I think can really help serve as a connective tissue, if you will, to so much good work happening across the ecosystem.
Yeah, amazing. You have the distinct honor of being the very first guest on this podcast that is a previous Microsoft employee, I think. And
How about
you,
that?
yeah, I think so. Someone will fact check me if that's not the case. But you spent more than 20 years at Microsoft. From, I think your first job was a product manager on Office and Windows, if my memory is correct. And you just grew to an amazing scale with the company, eventually being GM, I think, of the Microsoft store overall. What I want to ask you is, what did you learn in that time at Microsoft that you've brought into GeneDx? Because it's a much smaller company, but still having a huge impact. And there's a lot I think we can learn from the world's most successful technology companies like that.
Thank you. No, it was an incredible experience at Microsoft. I was there 23 years, which is nearly a lifetime, but I switched jobs every 2 or 3 years. And so it was essentially kind of having a startup-esque experience within a very lovely home base. Yes, my career started as a product manager. I giggle because this was in 1998, and my job descriptions were everything from writing press releases to defining product specs to, as a new kid out of college, I was also responsible for passing out the paycheck. So we didn't even have direct deposit at the time. And so I always laugh that that first job was a real spectrum of responsibilities. But I remember that first paycheck. I was very excited to get it. It was an actual check. But yes, that did lead to lots more interesting experiences over the years. But when I think about, what I carried forward from Microsoft, one, I think, is just the incredibly enablement that technology can create. So I saw technology and data-led technology transform so many industries while I was at Microsoft, finance, entertainment, shopping, travel. During that time, when I first started, we were all booking, airline tickets to a travel agent. And then, of course, we had, Expedia, and, saw travel really transform. So the opportunity for technology to transform entire industries is something that I saw come to life in many ways when I first, helped co-found Truveta. It was with several other Microsoft folks. And one of our big inspirations was, wow, this is wild, that of all the industries that should be transformed by data, healthcare should be at the top of the list. There's no greater need. There's no greater good to deliver for humanity. And so technology as an enabler is something that has definitely been a key lesson I've carried forward, and something that I'm very passionate about. It's the best way to scale. It's the best way to serve as many people as possible. And you surround that with the right clinical expertise, and it, really can, I believe, change the world. The second thing I took from Microsoft was the importance of hiring great people. And so whether it's, treating the teams that you inherit incredibly well, finding great talent to build great teams, great companies don't exist without great people. And so, that I think is something that has carried through in every company now I've been at, is a real high value placed on hiring talented people, taking great care of them, creating meaningful jobs and careers for people. And ultimately that leads to great businesses and great success. And then the third thing I would say that Microsoft was a wonderful learning ground, and for many things. I learned a lot about different disciplines, the importance of kind of framework thinking, the importance of scalability, the importance of being principle led. And one of the things that Satya Nadella, when he became CEO in 2015-ish timeframe, he really brought a strong perspective on leadership to the company. And so there was a real focus on leadership principles and the importance of being a leader. And I still carry those principles with me today, which are grounded in the importance of providing clarity, the importance of bringing energy to the job, and the importance of driving impact. And those leadership principles have held firm, for me as I've continued throughout my career.
I love that. Clarity, energy, impact. That's a super useful nugget. I wanted to ask about Truveta, actually. You already mentioned it, but you had a little startup in between Microsoft and GeneDx, which I think relatively recently got a more than $1 billion valuation and is doing really amazing things. Could you talk a little bit about that, what the original vision was and what the company does?
Sure. So the Truveta chapter was a fascinating one. It was formed in 2020 in the thick of COVID. And so, if we kind of take ourselves back in time, COVID it hit Seattle where I live early on. And there was a group of technologists and healthcare providers in the Seattle area that were like-minded, to come together to help understand what is going on with COVID. How do we, how bad is it? How do we treat people? How is the whole world kind of flying blind on what to do? And, that pandemic, I think, was such an illustrative moment for all of us. And it touched literally every single one of us in some way. So that was essentially the impetus behind multiple health systems agreeing to come together and share their health data with the goal of improving human health. And so Truveta ultimately was formed in those early days of 2020 with the mission of saving lives with data. It was 30 health systems coming together to share their health data to create this aggregate data source of 120 million patients that could be used for research and to help transform healthcare around the world.
Amazing. As we wrap up here, is there anything in particular? I mean, you're 7 weeks into the job at GeneDx, but what are you most excited about? You're probably thinking about 2026 already and what the big things are. Maybe you can share what you can share about what you're most excited about right now.
Thank you. It's just been an incredible 7 weeks. I think any job that you're excited to wake up and just dive in and you wish you had more hours in the day is a great job and a great way to live. So, I'm excited about so much. I'm excited about the team and the incredible people that I'm getting to work with every day. The authenticity of the team, the passion of the team, the expertise of the team is incredible. And I believe that together, we're going to really help, more and more families get those diagnoses as soon as possible. When I think about, what excites me for 2026 the most, it's really how do we help educate clinicians, including, pediatricians, including families on the value of genetic testing and the answers that it can provide to them. And the value of that knowledge is something that I believe so deeply the world needs. And I'm excited to work across this network and this ecosystem to make genetic testing more appealing, more accessible, and more available, to more and more babies around the world. And then I'm also inspired to see what we can discover from the data. Whether it's epilepsy is something that I'm very passionate about. My daughter has epilepsy. I've seen firsthand how hard seizures can be on a family. For her, it took about 5 years of experimenting with different medications to find a medication mix that would work for her.
Wow.
And, if you think about the value of genetic testing, I so badly wish we had had better testing when she was younger or that we had access to it. Because epilepsy, it turns out, is a highly gene-driven disease. There's 768 genes that, our genetic test looks across. And the ability to, laser-like focus again with precision on the genetic makeup of those genes to find the anomaly that leads you to the right medication faster. It's it's science that's here today. And so, helping as many people take advantage of that science and find more and more discoveries like that can really drive incredible advancements in people's quality of life, as well as their duration of life. That's, I can't imagine anything more exciting to work on.
Yeah, I couldn't agree more. Well, Lisa, thank you so much for sharing all this with us and spending the time. Is there anything that you're looking for from the audience? Are you hiring? Are you looking for certain types of partners or anything else on your mind?
Thank you for asking. We'd love for people to continue to get to join us on this journey. So many people in this audience, are in a similar space. And so please reach out to us at genedx.com, on LinkedIn. We'd love to meet more and more people that have like-minded mission in mind. We are hiring always. We're growing fast, and I think we have over 100 positions available on our website today, which is quite, and I can attest, this is an incredible place to work. Highly recommend. So welcome any of that interest as well.
Amazing. Well, perfect. Lisa, thank you so much. I really appreciate the time that you took with us today.
Thank you, Patrick. I enjoyed it very much.
And thanks everyone, as always, for listening. We'll see you next time. Thanks, as always, for tuning in to the GeneDx podcast. If you enjoyed today's conversation, the best way you can support the show is by sharing it with a friend or colleague who might find it interesting as well. We'd also really appreciate if you could subscribe, rate, and review us on Apple Podcasts, Spotify, or wherever you listen to podcasts. This helps other people discover the show when they're searching for content on genetics, precision medicine, or biotech. We always want to hear from you as well. If you have feedback or questions or want to be featured on the show, you can email us at podcast@sonogenetics.com. You can find me on LinkedIn, Patrick Short. You can find us as well, SonoGenetics, on LinkedIn, or reach out on Instagram at the GeneDx Podcast. And finally, a special thank you to the team behind the show who makes this possible. Joy Ismail produces and manages the show. Jane Reddy-Webster keeps us organized, and James Pierce from Selective Frequencies for his expert audio engineering. I'm Patrick Short, your host. Thanks again for listening, and we'll see you next time on the GeneDx Podcast.